In vascular surgery in particular, the surgical technologist needs to be attentive, organized, and knowledgeable. Some of these cases can be very fast-paced and life-threatening. While being efficient, remember not to remove instruments from the surgical field until they are handed back. You do not want to pull something that's tied to a vessel. Anticoagulants such as heparinized saline solution are used to prevent coagulation. This prevents thrombi from forming at the surgical site and reduces risk of embolus. It's also used to flush ports and grafts. Straight heparin, often referred to as hot heparin, can also be on your field. Coagulants maintain hemostasis and an anastomosis sites. Gel foam and topical thrombin can be used for this purpose. As in all surgery, it is very important to label your drugs correctly. However, these medications can have fatal results if misused. Thrombin is supposed to be a topical medication and can kill if injected. Vascular grafts are used to replace blood vessels or to patch a vessel. Grafts may be straight or bifurcated. The length is measured in centimeters and the diameter reflects the outside diameter. Grafts can be synthetic such as Dacron polyester, Gore-Tex, PTFE, which is polytetrafluoroethylene. These grafts have rings to prevent compression in areas like the popliteal space where a lot of bending takes place. Grafts can also be natural, such as banked human umbilical cord, bovine grafts, and autografts like the saphenous vein. Sometimes a patch is used to close an artery. Mattress sutures are placed at the end of the graft, and suture begins at the end and moves towards the middle where they are tied together. Synthetic monofilament non-absorbable proline or polypropylene or coated material is preferred because it's non-reactive and prevents endovascular clotting and emboli. Sometimes a felt pledget is attached to the suture to prevent the stitch from tearing through the arterial wall. There are also rubber shod stay clamps that go on the tips of straight hemostats to protect the delicate suture. Blood vessels are mobilized and positioned with a vessel loop for retraction, and the most common ones are made of elastic material that is passed with a right angle at the ends or clamped with the ends are clamped with a hemostat. Double arm sutures are used in vascular procedures. Often the suture would be placed at each end of the vessel and continuous suture is ran from end toward the middle. Another technique for closure is a circumferential incision or anastomosis is to place a double arm suture 180 degrees apart and run continuously towards each other. Be careful when passing a double arm suture. Some surgeons want you to wet their hands when tying suture so the suture will glide more easily. Vascular clamps are specifically designed to prevent trauma to blood vessels. Vascular scissors are extremely sharp and fine. Many have angled tips. Vascular forceps have very fine serrations at the tips to allow a secure grip without tearing or slipping. The DeBakey is the most common vascular forcep. Non-penetrating, shallow retractors are commonly used during superficial vascular surgery, such as the handheld retractors like the Sen, for example. The deeper surgeries, the Deaver, Richardson, and Balfour or other self-retaining retractors can be used. Fraser tips are commonly used in vascular surgery, and make sure you keep the suction available and the tip unclogged and ready to go at all times. A tunneler is used to burrow or channel through a connective tissue to make space for a tubular vascular graft. They often have detachable tips, so it's very important to make sure that they are all accounted for at the end of the case. Endovascular stents are tubular mesh implants that fit against the arterial wall, providing a physical barrier between the atherosclerotic plaque and the vessel lumen and to maintain patency. Vessel loops can also be used as a tourniquet by threading the ends through a bolster. This is called a Rummel tourniquet.